Hello and welcome to The Beat, a news and talk program brought to you by the Center for Community Media at Worcester State University. This introduction has been pre-recorded for future episodes due to the unforeseen circumstances that the pandemic may bring. We hope you enjoy this segment.
So I just want to start off by saying hello and thank you to Dr. Hirsh for joining us again on The Beat. So why do you think there are some people resisting becoming vaccinated?
Well, I would categorize them in a couple of different buckets. So there's some people that were just anti-vaxxers for a while. They just believed that somehow there were agents in the vaccine that caused more harm than good. There was a long debunked story about linking some of the vaccines that kids were getting to autism. So some people just have that basic distrust of vaccinations. There's another group of people that just don't think that the pace at which these vaccines were created makes them confident that they can be safe or that they work. And as I explained to you, it wasn't kind of an overnight discovery. This was really based on a lot of long-term scientific instruction and information that was coming forth from these other pandemics. And it was, the FDA and the Moderna and Pfizer were just so meticulous about how they did the testing. I feel that they're very safe, but there's a skepticism there in that second group. They're not necessarily anti-vaxxers, but they're anti-this vax. And then the third group is a group usually in the underserved populations, the community of color, that traditionally have just not felt comfortable with the medical institutions doing the right thing by them. You're familiar probably, and your listeners might be, with the infamous Tuskegee Experiment that was done in the 1930s, where African-American men who had acquired syphilis were not treated so that observations about what the natural course of syphilis looked like could be done. And instead of giving them medical care that would have made their lives much less painful, they suffered greatly. And it's a tragic and horrific racist black eye on the medical system. And the folks that are around to remember that, some of the older African-American citizens and others, they don't have a great deal of fondness for the medical profession or our recommendations. Similarly, the Latinx community remembers a time when in Puerto Rico, a contraceptive medication was being administered without people's knowledge to cut down on the number of births there. And, this is just a horrific remnant of structural racism within the medical system. I think that we are better now. We're not all the way better, but we have to spend a lot of time in those communities with trusted medical advisors. So, and if we can find people that, look and sound like the communities that we're talking to, it's a big help. And we've been very fortunate that between our two medical centers and the two community health centers, that we have had a lot of spokespeople that are from the Latinx community, are from the African-American community, from the Vietnamese community, that have all been able to help us message the confidence that we have in these vaccines. Whether it's going to make a difference, I don't know, but right now the clamor for the vaccine is certainly a lot louder than the hesitance. We just can't keep up with the demand, which I think is a better situation than if we had tons of vaccine and nobody was showing up for the appointments, So we're hoping we can catch up on the demand part. And you know that expression, a rising tide lifts all boats. If we get 75%, 80% of the community vaccinated, regardless of what communities they come from, the hesitant folk, maybe they'll see, hey, this is really looking good. Our numbers are going way down. The number of hospitalizations going way down. I'm going to get it. Or they'll say, no, I'm still not going to get it, but we've helped them by getting the herd immunity without them. I'd rather see everybody get it, but we're not quite there yet.
You mentioned herd immunity. So what will it take for us to reach herd immunity in the United States?
Well, percentage-wise, it kind of varies. The CDC has numbers somewhere in the 65 to 75 range. Dr. Fauci, you know, who is kind of the guru of all things viral, is asking for something in the range of 75. Governor Baker wants 80. I think anywhere between 75 and 80 would be wonderful. And I think that if we could just get the production of the vaccine and the distribution of the vaccine increased, we have the infrastructure now to get it out there. So I wanted to mention that for a second, Jill. I spent several of the last weekends training what we're calling our vaccine corps. So there's been a collaboration between Professor Jill Terrian of the Graduate School of Nursing here at UMass and the Commonwealth Medicine Group to get a training going at our Worcester emergency distribution site at the Senior Center. And we have trained now about 450 medical students, as well as another 200 graduate nursing students. We've also done refresher courses for some retired docs and nurses who wanted to come out of retirement to help with the vaccinations. So we have a vaccine corps or an army of close to 750 vaccinators now, because we also have some in the Worcester Medical Reserve Corps. And now what we're trying to figure out is how to best use this army. So clearly, many of them are going to the Worcester super site in Worcester State and to our site at Worcester Senior Center. But a number of them are going out with Dr. Castile in a mobile program, which is going out to the congregant homes, sober homes, homeless shelters, shelters that are used for folks that are sobriety homes, things like that. And they're going to those folks because they're so reluctant to do anything in a more formal, organized kind of a setting like those two other sites that I mentioned. So the students have been fantastic. They want to help. This is what they feel is their greatest long-term contribution to the health and wellness of Worcester. And so it's been a wonderful collaboration. And I think that's really what's going to get us the herd immunity is the sheer number of these students. And the students have been so talented at it that the president of the UMass system out in Amherst, which is like, we are part of it, the Worcester Med School is part of that, Marty Meehan has asked that they get dispatched to areas that are kind of hard to reach. So they've gone into East Boston, they've gone into the upper reaches of Massachusetts, they've gone out to some of the more depressed areas of Fall River and New Bedford and Lawrence. It's a wonderful thing to see how willing our students are. And many of the other colleges now that have a component of the public health or nursing thing, including Worcester State, are participating as well. And of course, Worcester State's nursing program is a big part of the super site over at the Brissett Gym. So it's been a great collaboration. I'm just so humbled by how willing people are to help us dig out of this hole. We got into a very, very deep hole. I think not so much here in Massachusetts, but there still was a lot of mask denial and, let's open up and, why aren't kids back in school? There's been so much naysaying about the decisions that the state and the city have made about limiting people's contact and things like that. And now this is the way to dig out.
Wow, that's all really encouraging to hear. Everything that you mentioned about the students helping out is great. On another note, though, many people believe that children do not have a serious of a reaction to COVID-19. Why would you say it appears that children are more resilient to the virus?
That's $1 million question. I don't think that that is really well understood. People have conjectured somehow that they don't have the same kind of adhesiveness to these droplets in their airways. People have said that maybe their immune system is more revved up from being exposed to lots of viruses in the school age time. We just don't know. But it does seem like their illness, if they get it, is for the most part very, very mild, not something that you would seek out medical attention. But there is this one thing which is called multisystem inflammatory syndrome in children, MISC, and that is a horrific infection that causes cardiac malfunction and respiratory failure and has a very high mortality rate. So we have been seeing an increase in this. And I don't know if it's because the kids have had COVID kind of brewing for a long time, and then it finally gets to a certain level, and then your immune system kicks in and attacks everything in your body where the COVID virus was. But it is serious, and we may end up regretting the statement that, oh, kids don't get sick. They may get not so sick, but when they get sick, they may get very sick.
We've talked a lot about herd immunity today. If we're able to reach herd immunity, do you think we'll have to get immunized each year for COVID-19 and continue wearing masks in public?
So let's talk about the vaccination piece first. I think that with the evidence that we've seen that these things do mutate and cause these variants, I'm almost sure that this is something we're going to have to get boosters for, like we do a lot of our other viral illnesses. I don't know, what the guessing game process is going to be about which variant is prevalent. And, that's how we do it with the flu. We try to figure out which variant is going to be the predominant one. And sometimes we guess right and sometimes we guess wrong. But let's go to the masks. We were really worried in December and January that we were going to see what was called a twindemic, meaning flu season peak at the same time as this huge COVID surge. The COVID surge came, but no flu. And what's the reason? Masks. Masks protected us from getting this flu outbreak. I am not sure that masks are going away. I think that what we may find is maybe it'll be a seasonal thing because it seems like COVID likes the cold. So does flu. Maybe it's like between November and February, we're wearing masks. I hope that we won't have to do the distancing thing, but the mask thing may be here for a while. I think it will be here with us probably in close quarters, like on planes and trains and buses. I think maybe even in movie theaters and places like that. But I think that, out and about doing your normal stuff, probably even shopping, I don't know that we'll need them. But, I wish I could predict that correctly. I would be Nostradamus.
So we've talked about a lot of great things today. You've given us some great answers. Is there anything, though, that we haven't covered that you'd like to add?
Yeah, I would just like to say that everybody is very tired. I know the medical staff going through this second surge, there was a tremendous amount of adrenaline in the first surge. Everybody was pitching in. Surgeons were giving up their surgical practice to work in the ICUs. Internists who normally just saw patients in the office were coming into the DCU center to help us with the recovering COVID patients. It was a real feel-good thing to see us all stand up like that. When the second surge came, there was just a feeling of, oh, not again, because everybody had kind of gotten back to a little bit more normal medical practice in the hospital, and then everything shut down again. There's a lot of fatigue on the medical side. I know there's a ton of fatigue on the population side. I hear it every day. I got to open up my restaurant. I'm losing my business. I gotta get back to normal. I gotta see my friends. I want to hug people. I'm a hugger too. I want to hug people too. I think people just can't give in to despair. They've got to understand there is a light at the end of the tunnel. Maybe it's not going to be 2021. That's the perfect new year. It's definitely going to be better than 2020, but it's not going to be as beautiful until towards the end of the year. But people have to understand there is light at the end of the tunnel, and we're all going to get through this. And I'm just so happy to see a new regime in Washington has given scientists much more sway in how we're going to attack this. And I think that's going to make all the difference. We won't have to argue about whether being a mask wearer is being a sissy or whatever. That's not going to be an issue anymore. We wasted so much time on crazy medications and bleach and light and all these crazy things that had nothing to do with anything. And now we can concentrate on the vaccinations.
Great. Thank you so much.
Hey, my pleasure. And thanks for having me.
Thank you for watching this segment of The Beat. Please remember to like us on Facebook and follow us on Twitter and Instagram. We will see you next time.